myself Dr. Dhaval Dharani. I am working as an infertility and fetal medicine specialist at Paaranu Women's Speciality Hospital, Gujarat, Surat. Today I am going to show you the procedure, invasive procedure from the fetal medicine department known as a fetal paracentesis. This is a very rare invasive procedure which we are going to show you. The patient details are like this. She is having the first pregnancy, 26-year-old, at present 27 weeks of pregnancy. This patient was unbooked for us. Patient has undergone one ultrasound at 3 months, anti-scan, it was normal, and recently when patient visited us, we have examined and when we have done sonography for her, we have found fetal ascites. There are various reasons for the fetal ascites. One of the reasons is a torch infection, another is a cardiac abnormality, third is a urinary tract obstruction, fourth is any space occupying lesion in the abdomen, and like this. As we have evaluated all these cases, we couldn't find any reason for the fetal paracentesis. But as it was massive, so we decided to do the paracentesis to reduce the compression for other internal abdominal structure. So we'll do the procedure ultrasound guided. We'll introduce the needle through the mother abdomen to the fetal abdomen, and we'll drain the ascitic fluid. As per ultrasound, it looks like around 80 to 100 ml of fluid has collected inside the fetal abdomen. So once we'll remove the ascitic fluid, there is a chance that it can regain again, but we can monitor the patient regularly and we can observe. But with the reduction of the ascitic fluid, it can give the space for the other internal abdominal structure to expand. So let us see the procedure for fetal paracentesis. Image, we can see the fetal ascites, liver, small intestine and other viscera are floating around the fetal abdomen, and there is around some 100 to 150 ml of fluid is collected inside the fetal abdomen. You can clearly see the urinary bladder and surrounding small intestine and other viscera. Now we are going to put the needle inside the abdomen. You can see in the small screen, we are putting the needle under the ultrasound guided directly into the fetal abdomen. You can see the tip of the needle inside the fetal abdomen, which is very bright and shining. Now in the small screen you can see that we are attaching the 20 ml syringe along with the needle, and using the negative suction we are aspirating the fluid from the fetal abdomen. In each single attempt, around 20 ml of fluid we will aspirate, and we will collect that fluid in one bowl. You can see it is a yellowish color fluid, crystal clear. Again we are attaching the syringe second time to the needle, and again using the negative suction we are aspirating the fluid from the fetal abdomen. With each aspiration, around 20 ml of fluid we are withdrawing with the fetal abdomen, and with that effect gradually the abdominal distension is coming down. Again you can see in the small screen. Again the third time we are attaching the needle to the syringe, and we are aspirating the fluid, around 20 ml of fluid we are aspirating. So as we are aspirating the fluid, gradually there is a decompression of the other abdominal structure, and gradually the reduction of the fetal ascites. While during this process, our needle will be constantly under our vision in the ultrasound guidance. This is the third time our assistant is keeping the fluid in the bowl. So around 60 ml of fluid we have aspirated till now. Again the first time we are attaching the syringe to the needle. You can see clearly in the ultrasound image that abdominal ascites is gradually reducing and the other abdominal viscera is gradually settling down. You can see that around 20 ml of fluid we have already aspirated again. So till now around 60 to 70 ml of fluid we have aspirated, and the image is clearly showing that ascites has gradually come down much more. Our needle tip is between the liver and the small intestine. You can clearly see the small deepening is abdominal skin. Throughout this process, our needle tip should be constantly in our vision. Now we have removed our needle, and you can see that ascites has gradually come down to much low level. Thank you. Gradually come down to much low level. Thank you.